All right, thanks a lot there, Chris. I'm Jamie Costello, and this story tops your local news at 5:30. I don't know if you've seen this new commercial. It's touting a new lung cancer drug. It's called Keytruda. This is supposed to be a big breakthrough here. One local mom who is diagnosed with stage 4 lung cancer says it delivered. But she adds it's only part of the solution, adding the clinical trial that she went through with her doctor at MedStar Franklin Square. It's all part of her miracle. Watch.
I went to my primary care because I had a sinus infection. And while I was there, she was like, well, you're a smoker and you haven't been for a while. I think you probably ought to get a chest x-ray just as a routine.
A smoker for 40 years, Natalie went through with the chest x-ray, which showed something. Then a CAT scan, which showed something questionable, resulting in a PET scan.
You know, you see like on TV, people are like, when I found out or when I got that phone call or whatever like that. But it was such a, process, oh, do this, oh, next do that. So you kind of knew, it kind of faded into your consciousness.
It was 2014. Her husband had just gone into remission in his own cancer battle. And that's when she met Dr. Rao with MedStar Franklin Square.
Natalie was one of my younger patients. She was working, she had 2 young children. She had extensive disease.
As the director of the thoracic oncology at MedStar Franklin Square, she worked with Natalie on treatment options. Natalie started with chemo, but she had adverse reactions, forcing her to stop one part of the treatment.
The tumors had shrunk, but then when I stopped the one part of the cocktail, they started coming back again.
That's when she and Dr. Rao moved on to a clinical trial involving immunotherapy.
The concept of immunotherapy, which is using their own immune system to help fight the cancer, I think is very appealing to patients. So it wasn't very difficult to convince patients to go on this trial, and Natalie was no exception.
Infusions took about 45 minutes and had minimal side effects. She was even back at work the next day after treatment.
Each one looked better. I mean, they started shrinking.
After 36 months, treatments every 3 weeks, Natalie was removed from the trial, her cancer gone. And that was 2 years ago.
It is a miracle. I don't think we would have had this happen without the immunotherapy. So it's definitely a miracle. To be able to tell our patients, yeah, you have a decent chance of being alive in 5 years and possibly without any treatment after 2 years. So that is something that is, I would not have imagined a few years ago.
I don't think I would have made it to my birthday even if I hadn't started the clinical trial.